Hello and welcome to this video. In this video, I'm going to take you through an overview of labor and childbirth. So specifically, we're going to define what labor is and also what normal labor is, as well as what premature labor is. Then we're going to explain the 5 characteristics of normal labor, as well as be able to describe the factors that influence onset of labor. We'll also mention at least 5 factors that affect the progress of labor, as well as be able to outline the 4 premonitory signs of labor. And lastly, we're going to discuss the main differences between 4 signs of labor and the true signs of labor. Labor is defined as the process by which the fetus, the placenta, and the membranes are expelled through the birth canal after 28 weeks of gestation. So, normal labor is defined as labor that occurs at term and is spontaneous in onset with the fetus presenting by the vertex. The process is completed within 18 hours and no complications arise for the mother or the child. And then we also have premature labor. Premature labor is defined as labor occurring before the 7th week of gestation. Okay, when it comes to the characteristics of normal labor, one of the characteristics is that it should be at term, which is 37 to 42 weeks. Then the onset is spontaneous. The presentation should be vertex. Duration is less than 18 hours, and there are no complications to both the mother and the child. Okay, now let's look at the factors influencing the onset of labor. We have 2 main factors that influence the onset of labor. We have the hormonal factors and the mechanical factors. Under the hormonal factors, we have increased levels of fetal cortisol. In the last months of pregnancy, the fetus produces more cortisol. This is produced from the adrenal cortex. The cortisol is thought to exert 2 effects. It slows the production of progesterone from the placenta, and it also stimulates the precursors to prostaglandin. The other hormonal factor is progesterone. During pregnancy, progesterone is available to sedate the uterus to term. This is initially secreted by the corpus luteum and later on by the placenta, causing sedation of uterine muscles. Oxytocin is another hormonal factor. It is produced from the posterior pituitary gland, meaning that as progesterone decreases, oxytocin is produced. Estrogen is another hormonal factor. So estrogen also stimulates the placenta to release prostaglandins that induce production of enzymes that will digest collagen in the cervix, helping it to become soft. Prostaglandin is the last hormonal factor that we can look at. So prostaglandin is known to stimulate the smooth muscles for contraction. Then when it comes to mechanical factors, we have increased activity. So there is increased activity of the uterus towards the term of pregnancy. The Blackstone-Hicks contractions come in and increase in intensity and the frequency as pregnancy advances. This also contributes to the onset of labor. The other mechanical factor is febrile conditions. So the high temperatures, they act as high irritant on the uterine muscles. You can give an example of the malaria parasite that can cause febrile conditions, acting as an irritant on the uterine muscles. The other mechanical factor is pressure of the presenting part of the cervix. So the hormonal action on the cervix results in the softening of the connective tissue of the cervix. Okay, let's look at the factors affecting the process of labor. When it comes to the factors that affect the process of labor, we have the 4 P's. The first P is known as the powers, which are the contractions of the uterine. The second P is the passageway or the birth canal in the bony pelvis, the cervix, the vagina, and the introitus. The third P, that is the passenger. So the passenger are the fetus, the amniotic sac, the umbilical cord, and the placenta. The last P, that is the psychological response or the position. Let's look at the premonitory signs of labor. So these signs occur 2 to 3 weeks before labor starts, and they determine the approach of labor. And these include the following. There is lightening. So this is the sinking of the uterus 2 to 3 weeks before term. So the fundus no longer clouds to the lungs and breathing is easier. The second one is softening of the pelvic ligaments and widening of the symphysis pubis. So the softened and relaxed pelvic floor bags allow the uterus to descend further into the true pelvis. The other one is the frequency of micturition. So mild incontinence of urine occurs due to weakened bladder control because of the pelvic floor muscle relaxation. So this reduces the sphincter function, which are the pelvic muscles. Then we also have the force pains or the Blackstone-Hicks. So the Blackstone-Hicks contractions are more intense but are erratic and irregular. These contractions that have been occurring throughout pregnancy and may become uncomfortable. We also have a sudden burst of energy. Some women report a sudden burst of energy approximately 24 to 48 hours before labor. The cause of the energy spurts is not known. There's also weight loss. So weight loss of 2.2 to 6.6 kg resulting from fluid loss and electrolyte shifts due to changes in estrogen and progesterone levels. Let's look at the first signs of labor. One of the first signs of labor is that the contractions often occur at night. Then the abdominal pain which the woman experiences during the contractions is much more intense than what could be expected for the strength and duration of the contractions. The backache is seldom experienced. Then the contractions are erratic and irregular in frequency and in duration, and last both longer and shorter periods than true labor. Now, for true signs of labor, you're going to notice that there is a painful rhythmic uterine contractions, and these contractions are characterized by tightening, discomfort, actual pain felt, uterine feels hard to touch. Contractions are more frequent and longer and felt in the abdomen. Then there is a shock which is present. So short discharge of blood-stained mucus from the cervical mucosa. There's also shortening and dilatation of the cervical os. So this is the widening of the cervix to permit passage of the fetal head. Usually results in the dilatation of the os depending on the pressure of the presenting part. There's also formation of the bag of waters. So this is formed by bulging of the membranes into the cervical canal, which has dilated easily, felt during the contractions. So this is what I had for you on an overview of labor and childbirth. If you like the video, please click on the like button, subscribe if you have not subscribed. Then if you have any questions, leave your questions in the comment section below. See you in the next video.